I'm Amanda Olsen and I'm a pelvic health physical therapist, and in this video we're going to discuss some ways of general maintenance for the pelvic floor to keep it going healthy and feeling good so that you can continue to live your life and reach your goals. The first exercise is breathing, and that sounds like a very basic thing to do. If you are living, then you are by means of that breathing. But the interesting thing is that the diaphragm that sits in the top of our rib cage and the pelvic floor want to be working together as a team, like a piston. And if there are disruptions in that, whether it's in the abdominal cavity or in the rib cage or in the pelvic floor, that can change how we stabilize our trunk. It can change how the pelvic floor behaves, and it can also change how we breathe. So the diaphragm that sits here and the pelvic floor that sits here want to work like a piston, actually. When we inhale and draw breath in, the diaphragm sinks down, and so does the pelvic floor. And then when we exhale, they come back to a neutral or resting place. So they inhale, exhale. So a really great exercise to get in touch with the location of your pelvic floor and the rhythm of the breathing is to either sit or lay down. Sitting is actually a really beneficial thing to do because you get a little bit of input into the perineum and the pelvic floor muscles. So you might be able to feel the drop a little bit more. These movements are very slight. They're not big motions that you can see, like when you bend your elbow. So you can place one hand on your chest to get a sense of your breathing. You can also place one hand onto your perineum so that you can feel that little drop and lift. And breathe in and allow your chest to come up and your belly to come up. And when you breathe in, feel that slight pressure coming down into your perineum, into your pelvic floor. And then exhale and feel it lift back up. Repeat that pattern for a few minutes and just get a general sense of how it feels. If you're not feeling any drop or relaxation, it may be that you're guarding or holding some tension in your pelvic floor muscles. You can practice it lying down for better comfort or sitting. You can even put a little towel roll, little hand towel rolled up right under the perineum here for a little bit of input into the pelvic floor there. From there, you can get a sense of doing a full active pelvic floor muscle contraction. So what that looks like is you would inhale and relax, exhale, and imagine pulling a blueberry into your vagina, and then inhale and let it come all the way out. So just getting full range of motion of the pelvic floor muscles. These contractions can be held for various periods of time, but just for general maintenance, you can just get it in a nice pull up, hold for a count of 2, and then relax and drop it down. That is a full range pelvic floor muscle contraction. A pelvic floor drop looks like breathing in and gently allowing a slight pressure to come into the pelvic floor. So as you inhale, almost as if you were going to pass gas, that little sensation of gently pushing. It's not a full thrust pressure down, and you're not holding your breath. So you're inhaling to relax and exhaling and letting it come down. So it's just a slight pressure. One of the visual cues that I use when working with patients sometimes is to imagine that you're just blowing a small bubble through the vaginal opening as if it were bubble gum. So it's just that gentle. You can practice that for 10 repetitions. You can practice the full range activations for 10. If you have any of the symptoms that we talked about in the previous videos, issues like incontinence or pelvic pain, your exercise program is going to look a little bit different than a general maintenance program, and you may be asked to do more exercises in one area and less in another area, depending on what your pelvic floor muscles need. Also, for general maintenance, getting a little walk or some aerobic exercise, like going for a run, going for a walk, playing some tennis, whatever it is that brings you joy, for at least 5 to 30 minutes a day just to get a little blood flow into the area is also very good for the pelvic floor. Additionally, having strong gluteal muscles on the back side is really important. In our lifestyle today, a lot of us do a lot of time sitting, whether it's for our job or just as part of our daily flow. And we don't often get a lot of opportunity to exercise our gluteal muscles. One thing that you can do is bridges, where you're laying down on your back and your knees are bent and you're just pressing the pelvis up and bringing it back down. You can even just squeeze the glutes together. So squeeze your bottom and lift and lower. Having good, strong gluteal muscles helps provide support to the pelvis so that the pelvic floor muscles are then freed up to do their job and they don't feel the need to strain to help support your pelvis. Additionally, as we talked about, they share that fascial plane. They back up to the pelvic floor muscles, so that helps them to work better as a team throughout your daily activities like bending over to pick up the groceries or getting in and out of your vehicle. Functional things that we do every day. And then finally, different yoga practices like child's pose, where you're laying down and curled up, and also happy baby, where your legs are out wide and you're holding onto your feet, are really helpful to help open and relax the pelvic floor. If you feel like you could benefit from more additional help, be sure to discuss with your physician any symptoms that you're having and to see a pelvic health physical therapist or occupational therapist. For more information and to discuss your unique condition, be sure to contact FemStrong Health. FemStrong Health is a collaborative team of multidisciplinary clinicians that work together to get you feeling your very best.